Hello everybody, so today our presentation will be on cat scratch fever. You might be asking yourself, what's the causative agent of cat scratch fever? It's actually the bacteria Bartonella henseli, which is a gram-negative bacteria, and it's short-lived or self-limiting. The transmission in cats actually tends to be quite simple, so it could come from the bite of an infected flea, but a lot of the time it actually comes from the ingestion of the excrement of said flea, also known as flea dirt. So there's other ways of getting it, like contact with the infected blood. So cats that are at most risk of this would be cats who are prone to fighting, which of course means intact cats a lot of the time, or cats who just got a recent blood transfusion. So the transmission in humans is also pretty simple. A lot of the time it actually comes from scratches from a domestic cat or a feral cat, and kittens are actually more likely to spread cat scratch fever, and children under 15 are more prone to actually show symptoms of it and get it. And according to the CDC, there is been a link to getting bites from infected cat fleas, but this has not yet been proven, so it's still being tested and people are trying to find out if it's actually true. So the disease progression in cats is quite linear. So the excrement is ingested. Once the excrement actually enters the digestive system and it's inside the cat, the bacteria will start reproducing. Eventually, the bacteria will enter the bloodstream. The symptoms in cats are actually pretty rare, but one of the biggest kind of worst symptoms you could get in a cat would be the inflammation of the heart. Now, when it comes to humans, the way that the disease usually gets into them would be the bite or a scratch from an infected cat. So the saliva can come into contact with the open wound caused by the bite, or the flea dirt on the claws of the cat that it gets on there because of its grooming can get into the open wound as well. So they usually show no symptoms for about 3 to 14 days, and then that's when the infection will actually start.
Okay, so clinical signs in cats. Cats tend to be asymptomatic carriers, so a lot of the time you're not actually going to know that they are carrying because they're not going to show signs, but there are some rare and severe signs or reactions that one might look for. Those are going to be things like pyrexia, vomiting, swollen lymph nodes, and chronic conjunctivitis. In humans, it's a little more obvious. Some common reactions. The most common reaction is going to be that red bump that appears at the site of the bite or scratch. That's this image right here. And then some other reactions, some other signs are going to be fever, poor appetite, headache, exhaustion, myalgia, and arthritis. So those are common. There are some uncommon and more severe reactions, and those are mostly going to be shown in those that are immunocompromised or who are a little bit younger. It's going to be from ages like 5 to 14. And that's going to be neuroetinitis, osteomyelitis, encephalitis, and endocarditis. And just a little note that dogs tend to show the same signs as humans. And as far as diagnosis in cats go, you're going to be looking at the history first. So, does the cat have fleas? Has the cat had fleas? Has it interacted with feral cats that might have fleas? There are blood tests you can do, urinalysis, biochemistry profile. The sort of gold star as far as diagnosing this is going to be cultivation of bacterium from blood or tissue. So here we've got a blood draw from a cat. Another diagnostic tool is going to be amplifying Bartonella henselae specific DNA sequences using PCR. Got some DNA right there. Diagnosis in humans. Similar. Obviously, we're going to start out with the history. So, do you own a cat? Has your cat scratched or bitten you? Have you been around a cat that has scratched or bitten you recently? Do they have fleas? That kind of thing. And then the number one for humans is going to be serology. So, indirect fluorescent assay or enzyme-linked immunosorbent assay, or ELISA test. This is extremely difficult to culture, so it's not often recommended. Really, the only reason one would culture this is if the person that is suspected to have it is immunocompromised. That tends to be really the only reason that it's recommended. But another diagnostic tool is going to be removing a sample of fluid from the lymph node and using the PCR technique to increase the amount of bacteria and DNA, so similar to the other technique in cats.
Treatment in cats. An antibiotic treatment for 4 to 6 weeks. There is no way to completely clear Bartonella Hensley completely from the blood. Antibiotics only recommend for those with clinical signs. Treatment in humans. The infection does not usually cause severe complaints, but it can lead to problems for people with a weak immune system. Those with healthy immune systems, infection is self-limited. Apply heat to the affected area. Compromise individuals antibiotics. Presence on in cats. There are no vaccines available. The only present on is flea and tick control. Present on in humans, people who have weakened immune systems should avoid owning cats less than 1 year old. You can prevent cat scratch fever by avoiding contact with cats. If you have a cat, avoid rough play that could lead to you being scratched or bitten. You can also keep their nails trimmed to reduce scratches. Wash your hands after playing with your cat. May also help prevent the disease.